My work in these Detroit areas, it was optional. I'm a surgical resident at the University of Michigan, and I had this opportunity to go work in these areas, and I've chosen to do it. And when this pandemic started, there's the option to stop out of danger. And I just couldn't stop based on who I was seeing dying and knowing I had a skill set to help. And so I think that probably affects me differently than some other physicians who are not of color.
Welcome to We Roar. This spring, with coronavirus disrupting all our lives, we're reaching out to Princetonians everywhere to hear how we're continuing our collective and personal missions, how we're staying together at a distance, and how so many of us are working to serve the wider world. This episode, with a doctor on the front lines in Detroit, explores why African Americans are dying disproportionately.
My name is Glenn Wakam. I'm from the great class of 2011. I'm currently a surgical resident at the University of Michigan who's been spending his nights and weekends over the past few months working at a Detroit area hospital. The disproportionate amount of infection and death in the African American community has been extremely jarring. It was our experience at that hospital, but at the time when it was happening, we just thought it was a reflection of just the local community. And personally, I didn't think much of it. Sort of as an African-American doctor myself, when the people start dying that look like me, it affects me in a different way. And so that's what I thought I was feeling. And then as the numbers across the country start coming out and revealing this is experienced pretty much nationwide, and not universally, not worldwide, nationwide. So this was a uniquely United States problem. It just then revealed that the amount of infection and death is disproportionate to their population size. So in the home state of Michigan, it's 14% African American. African Americans, though, have counted for 40% of the deaths. As recently as 2 weeks ago, in St. Louis, African Americans had, although they were something like maybe 20% of the population, accounted for 100% of the deaths. So every person who had died was African American. And, those numbers might have changed around a little bit, but not I bet if we looked them up right now, they're roughly the same. And it's even worse, too, when you even get into even smaller areas. Like, for example, Washington County, where I live, I think the African-American population is, less than 10%, but the deaths and infections have, again, been greater than 40%. When this all started, COVID-19 was touted as the great equalizer. Officials said it didn't matter your race, your religion, your socioeconomic status, that this would affect us all the same. And that's just not true. It's one of the $1 million questions of what is happening that is causing communities of color to be disproportionately affected. There is some things that are obvious. The underlying health is poorer in these communities. They have higher rates of obesity and hypertension. And so, and people with comorbidities do worse with this virus. But then you go back and you think, why do they have higher rates of obesity and hypertension? At Princeton, I actually was a sociology major. And, even in 2002, there was a landmark report, Unequal Treatment, released by the Institute of Medicine that highlighted out the very stark differences in healthcare, access to healthcare, transportation, healthcare outcomes of every major disease by race. And what the pandemic has realized is we've really made no progress. There's some things that infant mortality rate, maternal mortality rate in African American women has gotten worse instead of better over this time. My senior thesis, when I was at Princeton, I looked at the healthcare outcomes of African immigrants to this country. And it turns out when they get here, and I'm a first generation, my parents are from Cameroon, so this, hit home with me. When African immigrants come to the United States, they have equivalent healthcare outcomes to white Americans. And then within one generation, so their children, so me in this example, their outcomes plummet to the equivalent of African Americans who have lived here for generations. And so it is not a genetic thing. The rates of hypertension and diabetes in Africa aren't higher. And so then you think that there's underlying things about our country and our healthcare system structurally that disproportionately disadvantage people of color. And so that is part of it. And then the other part of it is the essential workers, the people who clean the hospitals, who work the grocery stores, nurses or techs are disproportionately people of color. And so they can't socially isolate or work from home. That's a luxury that they don't have. And then their transportation to work a lot of times can be predominantly on public transportation where you can't socially isolate or distance. And so effects like that, where even people who didn't have worse underlying health are just put in situations where they haven't been able to really protect themselves early on. And I think the real issue is that what you need to truly solve the problem is to truly solve the problem of historic legacy of structural racism and inequality and implicit bias, right? And so those are big things that's hard for anyone to bite off and chew. I think what's interesting and what I think more people need to know is what can we do? What little changes can we make? So are we going to fix the amount of people in low income areas without access to healthcare or who don't get paid a decent living? Like, yes, politicians should definitely work on that. But as we know, if anything in politics, that's not happening next week. But, can we talk about what are the safety nets in place in your local community and how those are being utilized, how those are funded? Can we donate to those and fix local problems? I think we all can do that without any legislation passed. I think those are the things that people and individuals and small communities need to start doing to make sure people of color around them or in their communities or in their nearby communities are getting a fair shake at life. And I think if everyone just did a little bit, you did something, one thing, whether it was volunteering, donating money, campaigning, if everyone did one little thing, I think we can make big changes. My work in these Detroit areas, it was optional. I'm a surgical resident at the University of Michigan, and I had this opportunity to go work in these areas, and I've chosen to do it. And when this pandemic started, there's the option to stop out of danger. And I just couldn't stop based on who I was seeing dying and knowing I had a skill set to help. I truly hope my career is different as a result of this pandemic. I came with a heavy background in disparities and sort of have, I don't want to say let it go, but I just haven't been as active and involved in terms of the research I do and the things I think about. And I think this has reinvigorated me to think about these issues, talk about these issues, research these issues, and bring them back to the forefront. So I hope these experiences, this pandemic, leaves me with a sustained passion of fighting these issues. I mean, they're hard and change is slow, so people can often fall off on things like that, like human nature to want a little bit more gratification. But, this has been such a jarring experience. I hope it leads to a sustained, profound impact on me.
This podcast is a production of the Princeton University Office of Communications. The opinions expressed herein represent the views of the individuals involved, not those of the university. Princeton podcasts are available on major distribution channels, including Spotify and the Apple and Google Podcast apps. If you have suggestions for future episodes or topics, please send them to podcasts@princeton.edu.